As winter 2026 unfolds, a new and unexpected health threat is sweeping across the United States, what experts and the media are now calling the super flu. Unlike anything we've seen in recent years, this outbreak is causing widespread concern, filling hospitals and clinics with patients, and prompting urgent headlines across the country. The term superflu might sound like something out of a science fiction movie, but the reality is both more complex and more alarming. This isn't a fictional virus engineered in a lab, but a real, fast-mutating version of influenza A, specifically the H3N2 strain, which scientists have now identified as subclade K. In laboratories across the world, researchers are racing to understand how this particular subclade has managed to spread so quickly and evade many of our usual defenses. What makes this flu super isn't that it's more deadly for each person who catches it, but rather its extraordinary ability to infect huge numbers of people in a very short time. The virus is spreading at a pace that far outstrips what we typically see during flu season, overwhelming public health systems and outpacing the protection offered by our annual vaccines. The annual flu shot, which many rely on for protection, is struggling to keep up. Clinics are seeing long lines as people rush to get vaccinated, but the effectiveness of this year's vaccine is lower than usual. The reason? The virus has changed just enough, through a process scientists call antigenic drift, that our immune systems and vaccines are having trouble recognizing and fighting it off. Antigenic drift is a natural process where the flu virus accumulates small genetic changes over time. These changes can make it harder for our bodies to recognize the virus, even if we've been vaccinated or had the flu before. This year, subclade K's mutations have been particularly significant, making it a moving target for both our immune systems and the scientists working to update vaccines. The rapid evolution of subclade K caught scientists and public health officials off guard. Despite their best efforts to predict which strains would be most common, the virus changed course, making this year's vaccine less effective than hoped. Researchers are now working around the clock to develop updated vaccines and new strategies to slow the spread. The real danger of the superflu isn't just its speed, but the risk it poses to the most vulnerable among us. The very young, the elderly, and people with chronic health conditions are at the highest risk of severe illness and complications. Hospitals are seeing more cases of pneumonia, respiratory distress, and other serious outcomes, especially in these groups. As scientists and doctors work to understand this ever-changing virus, public awareness and prevention become more important than ever. Simple actions like hand washing, wearing masks in crowded places, and staying home when sick can help slow the spread. Understanding the science behind the superflu is key to protecting ourselves, our families, and our communities, and staying one step ahead in the ongoing battle between science and disease. The superflu's impact is visible everywhere. Hospitals are overwhelmed with over 180,000 hospitalizations. Emergency rooms are packed beyond capacity, and the sound of ambulance sirens has become a constant in many neighborhoods. Medical staff are working around the clock, often skipping breaks and meals, just to keep up with the relentless influx of patients. The strain is evident not only in the numbers, but in the faces of exhausted doctors and nurses, and the worried families waiting for news about their loved ones. Tragically, thousands of deaths have already been reported, and the toll continues to rise each day. Families are left grieving, sometimes unable to say goodbye due to strict hospital protocols. The emotional weight is heavy, as communities mourn the loss of friends, neighbors, and loved ones. For many, the reality of the crisis hits home only when it touches someone they know. Vulnerable groups, children, seniors, pregnant women, and those with chronic illnesses are at greatest risk for severe complications. For these individuals, what might be a mild illness for others can quickly become life-threatening. Pediatric wards are seeing an uptick in admissions, and geriatric units are stretched thin. Pregnant women face unique risks, and those with underlying health conditions are urged to take extra precautions. In many states, flu activity is at its highest, filling ERs and ICUs, and even delaying other medical care. Hospitals are forced to triage patients, sometimes turning away those with less urgent needs. Elective procedures are postponed, and some patients wait hours, even days, for a bed to become available. The ripple effect is felt throughout the healthcare system, as resources are diverted to manage the crisis. Schools and workplaces are disrupted, with classrooms sitting empty and offices closing their doors. Parents struggle to find childcare, and businesses face staff shortages as employees fall ill or stay home to care for sick family members. News crews gather outside hospitals, reporting on the latest developments, while inside, families face heartbreaking moments, like New Jersey's first pediatric flu death, a stark reminder of the stakes for our youngest and most vulnerable. When hospitals are stretched thin, everyone's care suffers, from postponed surgeries to longer ER waits. Patients with non-flu emergencies, like heart attacks or injuries, may find themselves waiting longer for treatment. Routine care is delayed, and the backlog grows with each passing day. healthcare system, already under pressure, is pushed to its limits, and the consequences are felt by all. Healthcare workers face burnout and illness themselves, compounding the crisis. Many are working double shifts, sacrificing time with their own families, and some have fallen ill, further reducing the workforce. The emotional and physical toll is immense, as they comfort grieving families, make difficult decisions, and try to protect their own health in the face of constant exposure. This season is a stark reminder. Flu is not just a personal risk, but a community-wide emergency. Public health officials urge everyone to take precautions, get vaccinated, wear masks, and stay home when sick. The actions we take now can help protect the most vulnerable among us, ease the burden on our hospitals, and save lives. In times like these, our collective responsibility has never been clearer. In recent months, a new variant of the H3N2 flu virus, known as subclade K, has rapidly become the dominant strain, now accounting for over 90% of all H3N2 cases worldwide. This dramatic rise has caught the attention of scientists and public health officials alike, as the speed and scale of its spread are unlike anything seen in recent flu seasons. Hospitals and clinics are seeing a surge in patients, and communities everywhere are feeling the impact as the virus moves swiftly from person to person. What makes subclade K so successful at spreading? The answer lies in its genetic makeup. This variant carries a series of mutations in its surface proteins, specifically the hemagglutinin and neuraminidase proteins, that act like a disguise, making it much harder for our immune systems to recognize and attack the virus. These subtle changes allow the virus to slip past the body's natural defenses, infecting people who might otherwise have been protected. Even individuals who have previously been exposed to H3N2 or who have received the seasonal flu vaccine may find themselves vulnerable. The antibodies their bodies produced in response to earlier strains are now less effective, struggling to identify and neutralize this new version of the virus. This means that people of all ages, from the elderly to young adults, are at risk of infection, leading to more widespread illness in the community. Timing has played a crucial role in this outbreak. Subclade K emerged and began spreading after the annual flu vaccine formula had already been finalized and manufactured. As a result, the current vaccine is not a perfect match for this new variant, leaving a gap in our defenses. This mismatch has made it even easier for subclade K to circulate and infect large numbers of people. This situation highlights the ongoing cat-and-mouse game between flu viruses and public health experts. Every year, scientists work tirelessly to predict which strains will be most common, but the flu virus is constantly evolving, always staying one step ahead. Tracking these changes and responding quickly is a never-ending challenge for those on the front lines of disease prevention. Fortunately, while subclade K does not appear to cause more severe illness on a case-by-case basis, its ability to evade existing immunity is what's fueling the current surge in cases. This means that even a relatively mild virus can have a major impact if enough people are susceptible, overwhelming healthcare systems, and putting vulnerable populations at risk. The key takeaway is clear. Flu viruses are masters of adaptation, and their rapid evolution makes global surveillance more important than ever. Monitoring new variants as they emerge, sharing data across borders, and staying alert to changes in the virus are essential steps in protecting public health. To keep up with these ever-changing threats, we need to invest in better, broader vaccines, ones that can protect against a wider range of flu strains. Only by staying ahead of the virus can we hope to reduce the impact of future outbreaks and safeguard our communities. How well does this year's flu shot work? The answer lies in timing. Vaccine formulas are set months in advance, based on global surveillance and predictions. But subclade K appeared after the decision, leading to a mismatch between the vaccine and the dominant strain. The vaccine's antibodies are like a key that almost fits the new lock, offering some, but not perfect, protection. This cross-protection can mean the difference between mild and severe illness. Even with a mismatch, the vaccine still helps prevent hospitalizations and deaths. The takeaway: the flu shot remains a vital tool, even in a tough year. Timing is everything in the fight against flu. Despite the mismatch, this year's flu vaccine is making a difference. Data from the UK shows 70–75% effectiveness at preventing hospital visits in children, and 30–40% in adults. That's a significant reduction in severe cases, especially for kids. Doctors report that vaccinated patients who do get sick have milder symptoms and recover faster. Most severe pediatric cases are among the unvaccinated, a powerful argument for getting the shot. Even in a perfect year, flu vaccine effectiveness varies, but partial protection is far better than none. The numbers are clear. Vaccination keeps people out of the hospital and saves lives. Every shot counts, especially in a super flu season. A troubling trend is making things worse. Fewer children are getting vaccinated against the flu. Coverage has dropped from nearly 64% pre-pandemic to just over 42% this season. That means more than half of U.S. children are unprotected as the superflu spreads. Pandemic disruptions, vaccine hesitancy, and misinformation have eroded trust and routine care. The result? Pediatric hospitals are seeing more severe flu cases, almost all in unvaccinated kids. This is preventable. Flu shots are proven to protect children from serious illness and death. Rebuilding trust in vaccines is urgent for families and communities. Increasing childhood vaccination rates is essential to ending this crisis. Let's clear up the myths. You cannot get the flu from the flu shot. The vaccine uses inactivated virus or a single protein. Neither can cause infection. Mild side effects like soreness or a low fever are signs your immune system is working, not illness. Flu vaccines have a long-proven safety record, monitored by the FDA and CDC. Concerns about ingredients like thimerosal are unfounded. Single-dose, preservative-free options are widely available. Misinformation spreads fast online, but the scientific consensus is clear. The flu vaccine is safe and effective. Serious reactions are extremely rare, far rarer than complications from the flu itself. Trust credible sources and protect your family with facts, not fear. Even with a less than perfect match, vaccination is your strongest defense. The main goal: prevent severe illness, hospitalization, and death. Vaccinated people who get the flu usually have milder symptoms and recover faster. Getting your shot also protects those around you, especially the most vulnerable. Community-wide vaccination reduces the virus's spread and impact. The CDC says even partial protection is valuable. This season's data proves it. In a super flu year, choosing vaccination is the responsible choice for everyone. Flu season runs through May, so it's not too late to get vaccinated. Protection kicks in about 2 weeks after your shot. Act now to stay ahead of the virus. The CDC recommends everyone 6 months and older get the flu vaccine. Vaccines are widely available at clinics, pharmacies, and workplaces. Don't assume youth or good health makes you immune. Flu can be severe for anyone. Combine vaccination with good hygiene. Wash hands, avoid sick contacts, and stay home if ill. Together, these steps can help us all weather this super flu season safely.